Authorities of the Ankara Psychiatric Hospital say they are likely to refuse admissions to new patients and send those already on admission home if government does not provide them with funds. According to the medical director of the hospital, all the hospital receives are assurances of provision of funds and other medical supplies. The acting clinical coordinator of the hospital says suppliers are on their neck to pay back the supplies of many years. The whole of this year, nothing has been given them to feed and fund the activities of the hospital. Let's now speak with Richard Kojo Nyako for some clarity on this. Hello, Richard. Hello, Richard. Can you hear me?
I can hear you, Gifty.
Very well. Where are the acting clinical coordinator speaking? Where was he speaking when he made this revelation?
Well, Latter-day Saints Church in Cape Coast went there to donate some items, food items and other toiletries to the hospital. So it was there that the acting clinical coordinator of the Ankara Psychiatric Hospital, Dr. M. Fadazi, revealed to the media that very soon they would be refusing admissions to patients, psychiatric patients, and those that are currently on admission, they are likely to allow them to go to their respective homes because there is no food for them to feed them with, and there are no funds to cater for them. And according to him, government has been giving a series of assurances to them, but I mean, after the assurances, they do not give them any money to fund the activities of the hospital. Remember that recently the chief psychiatrist, Dr. Osei, came to the central region and actually carried out some operation where those who were in chains, some mental patients that were in chains, they unchained them, beat them, and then sent them to the hospital. So that has added to the population of the hospital. So if there are no food items that are coming, there are no toiletries, there are no consumables that are going to the hospital, it means that they are really in a serious trouble. And apart from that, they also owe suppliers. For 3-4 years, they've been suppliers have been supplying materials and other items to the hospital, but they've not paid them, and so the suppliers are constantly on their neck. And so that is what has stated this comment, that they want government to actually give them some money in order for them not to send these people that are already in the hospital away.
Okay, thank you very much, Richard Kojo Nyako, with that update on that story.